I think that tape piece does a great job of setting up the story and where we now stand. I don't necessarily love that we're overusing superbug, because really what this is it's a potentially deadly antibiotic-resistant bacteria. And there's a difference between when we're talking about the bird flu, these viruses that are mutating in nature, versus these bacteria that are mutating in our very own hospitals, because we actually are partly to blame for this scenario, and it sickens me as a physician, because we're all in this. We're all to blame. Overprescription of antibiotics, improper hand washing.
Yeah, patients not washing our hands.
Sure, and it's tough because the patients getting this are usually pretty sick to begin with, and I think there's like a 50% mortality rate if you get an infection like this in your blood.
Well, and the good news is that otherwise healthy people, this is not really a bacteria, carbapenem-resistant Enterobacter. This bacteria normally lives in your gut, and most people, if you're otherwise healthy,
it's not
probably.
A problem.
But what are most people in the hospital doing there?
Because they're sick.
Yeah,
and these are the people that are more likely to contract this, and that's why it's so important that the healthcare workers there are more vigilant in terms of the two things you said: prescribing antibiotics correctly and washing your hands using all the proper precautions.
But again, and I think I've said this before, is I do think there does need to be more aggressive research into developing antibiotics, because they are going to evolve. The bacteria are going to evolve as we keep treating them. So we have to be one step ahead of the bacteria, knowing where they're going to go.
The great irony of this situation is our overprescription of unnecessary antibiotics and lack of development of necessary antibiotics has gotten us in this quagmire, because we have antibiotics that we just use indiscriminately.
Right.
You know, a recent study looked at 12,000 people with upper respiratory infections had to be treated with antibiotics to prevent one case of hospitalized pneumonia.
But how long has it been since antibiotics have changed? Don't you prescribe the same ones over and over?
Because there's no
again?
financial incentive to create new ones, because you just make a boatload of money on these old ones. And there are no incentives, because these infections are very rare. So a drug company needs to be incentivized to create the next great antibiotic. And unfortunately, those incentives aren't there, because if you think about it, the reality of our lives are chronic illnesses. You know, people are taking these medicines over and over and over again. Those are gangbusters. They make a lot of, but antibiotics that may be used in these acute scenarios, this is where maybe we need to have a little bit more of a formal incentive program, because we're physicians, and we're still talking about the same antibiotics that we learned in medical school many, many years ago.
20 years ago, It's all the same.
And that's all fine and good, because some of them are still really effective, but what are we going to do? Because without incentives, drug companies aren't going to
because the drug companies want to produce medications that people take every day to lower their cholesterol, control their blood pressure, other chronic diseases, and not antibiotics.
And I think the takeaway here is we need to be more vigilant. But the important news right now is that if you're otherwise healthy, this really isn't something so much that you have to be as worried about as it is if you are unhealthy, sick in the hospital. And our hopes just have to be that we do develop some new antibiotics that can combat these antibiotic-resistant organisms. And we'll certainly keep you posted if this outbreak worsens across the country.